This is one of the official tests available uh, in the books. And the reason why we are doing this is to help you understand the real difficulty level of the test. Now, how is the timing for writing test? You get a total of 45 minutes time, where 5 minutes time is a strictly reading time, which means in this 5 minutes time, you may not be allowed to have pen or pencil in your hands. You can't really mark anything. It is just reading time. And 40 minutes is the writing time. You need to write the letter in 180 to 200 words. So 40 minutes is adequate time for you to understand the whole situation and to write the letter. Now, how do you interpret? How do you make most of this 5 minutes time? Is you have a proper strategy or steps while reading through the case notes. So here you can see that in the notes, you'll always have this notes in the beginning. What would these notes include? They would give you an introduction of who the patient is and in which situation you are. Like as I mentioned earlier, you could be writing a discharge summary. So in that case, you may be in a nursing home, you could be in emergency department, you could be in hospitals, retirement homes, and things like that. So the notes will give you that background. So this isn't a problem when you are writing real life referral letter, because you are working in that particular department, so it becomes easier for you to understand that. But it gets tricky when you have to write a referral letter just based on a piece of paper. So here you get to know who the patient is. So here it is written, Mr. Collister is a male patient in your general practice. So that means you are a general practitioner and he is one of your patients. After reading the notes, you do not read this notes, you don't go on to read the case notes, because if you do not have any purpose to read them, you can easily get distracted. So what you do is, after reading this, you directly jump to the writing task. The writing task will tell you who the target reader is. Whom are we writing this letter? So here you can see it says you're writing to Dr. Cross, and endocrinologist. What is the purpose of writing? Requesting assessment and management plan. He is a consultant endocrinologist. Right? So again, this becomes a letter where you are referring the patient to a specialist for further assessment and management. Now, keeping these two things in mind, that you are a general practitioner. So when you are a general practitioner, the patient may have visited you for many, many years, and you may have a huge data from the patient. Maybe in some cases, right from the childhood up until, they get older, 40, 45 years old. So when you are writing a referral letter to a specialist, you would have to pay attention to those issues which are relevant for that specialist. So once you have read these two things, then you start reading the case notes. And when you start reading the case notes, you have two questions in your mind. One is, what information is required for the target reader, and what information is not relevant for the target reader. So with these two questions in mind, now I want all of you to read through this case notes and to get a general idea of what information are you going to include or exclude in your letter. So we have a total of 6 visits here. Okay. Have you all read it once? Okay. Now, if you all have read it once, I would bring the evaluation criteria on screen to help you understand what do you have to focus upon while writing a referral letter. What is being tested? Yeah, you must know what the examiner is looking for so that you can tailor your task or your performance accordingly. So you have a total of 6 evaluation criteria: purpose, content, conciseness and clarity, genre and style, organization, and language. Now, if you look at the purpose criteria, it tells you, it helps the reader to get a quick and precise sense of what is asked of them. So, this is an important factor that you would have to consider. So, even in this particular task, if you look at the case notes, yeah, you have a lot of information about this particular patient. The purpose of writing this letter is requesting further test or further confirmation of diabetes. So that is your main story. So when you are writing a referral letter, you would have to imagine, or you would have to create a story of that patient in your mind, and you would have to narrate that story related to that particular purpose to the target reader. The task is not to summarize everything that is given, right? Similarly, look at content criteria. It says considers audience awareness. What does the reader need to know? And it also considers accuracy of information. So accuracy means the timelines should be clear. If you are writing about certain problems, then it should be clear what type of pain it is, or for how much duration is it there, using appropriate tenses, not misinterpreting or misrepresenting the information. And third criteria, conciseness and clarity, that considers again audience awareness, whether you were able to exclude irrelevant information. What is the target reader doesn't need to know. Okay? And another aspect which is very, very important here is how effectively are you able to summarize. So what is a good summary? Okay, is the summary that clearly gives a precise sense of what is being asked of them, and that clarity can only be showed if you are able to leave out irrelevant information, and if you are able to comprehend the task really well, and if you are able to put it forward in a very concise manner. So this was the reason, these three criteria are the reason we follow that 5-step strategy in the beginning, where we first pay attention to who we are, who the target reader is, what is the purpose of writing, and the next two questions we ask ourselves is what information is relevant for the target reader and what information is irrelevant. So if you make any mistakes at this stage, it could have a huge impact on your overall score, because C3 evaluation criteria are mainly focusing upon your ability to pick up relevant information from the task. So now in this task, okay, it gives you very clearly here that your preliminary diagnosis is diabetes type 2, and therefore you are referring them to endocrinologist. So if you have to show this story to the endocrinologist, you would have to think, if I consider this as diabetes, okay, what all things would the endocrinologist need to know? They would need to know the details of signs and symptoms which particularly lead to the diagnosis of diabetes, not all the signs and symptoms that they are experiencing. Any of the physical examination findings, again, that may help me to prove that this could be diabetes, and test results, which can again help me prove that this is diabetes. So this is the main portion. This is going to be the main portion of my letter. And then the other issues, if they are relevant for the target reader, then the risk factors which are relevant for the target reader, those things can be compiled. So now let us open up this forum. I'm going to open it up to all of you, and we are going to discuss in this particular task, okay, point by point, whether we can include or exclude certain points. So I'm just opening up the microphones for all of you. Feel free to discuss. Let us start right from the patient details. Which portion do you think will be required from patient details? Keep two things in mind, the endocrinologist and the purpose of writing.
I'd say height
Mm-hmm.
and occupation.
Name of the patient?
The name, okay, yeah, definitely we would be including the name.
Occupation?
Age, occupation, Yeah, because the endocrinologist doesn't know them at all. So maybe I would write the occupation.
But that doesn't have anything to do with
Doesn't have
that.
anything to do with. Yeah, that's correct. The
Yeah.
only thing is when you are introducing a new patient to them, it's a formality that you tell them who they are basically. So just a short sentence. You wouldn't say he is a factory foreman, but when you're writing in the introduction paragraph, probably there you could write Mr. Collister, a factory foreman, who is. So that is how you can include that.
By that,
Social background.
should we include social background? Because, I mean, yeah, social background should be included.
Yeah. Can you say why?
Um,
And
What impact would it have on his diabetes? How about hobbies?
and no hobbies included.
no,
Why? Why?
included.
We have to include that
We
because
have to include that? Okay,
yeah,
why?
because we are referring him for
Kathan, your voice is very low. It's not
okay.
coming across clearly.
So we are referring him for diabetes
Hmm.
mellitus type 2.
Hmm.
So we have to know his physical activities, the level of
Hmm.
physical activities he is doing in his routine life. So we
Hmm.
should include his occupation and medical history and
Okay.
hobbies.
Hobbies. Okay. Now, do I need to exactly say what the hobbies are, or can I,
No.
paraphrase it in a way to convey the message that I'm trying to convey?
Yeah, because in the history itself, it says that his lifestyle, diet, and exercise is not that good.
Yeah,
Yeah, sedentary.
yeah,
Yeah,
sedentary lifestyle.
Yeah. So yeah. So here I cannot completely exclude his hobbies, but again, I would not need to exactly mention what the hobbies are. Maybe I can use a phrase where I would say his lifestyle is sedentary, or
Hmm.
his hobbies are sedentary, or he does not involve in much of physical activity. So in that way, I would be including it. So we need this points. We need the name, of course. We need this is optional, factory foreman, and this we definitely need to indicate what kind of lifestyle he has. There are no allergies, so in that case, I wouldn't need that. If allergies were there, then I would need to specify. And how about the mononucleosis that he has? Would I need that?
It's taken care of already. So
So no need to.
six had it.
Hmm. Okay.
Currently, we are looking at 2018 and 19. So I don't think
Hmm.
make much of
Yeah.
a relevant information.
The only factor you can consider here is mononucleosis can be sometimes dormant and it can cause recurrence. So again, this is a piece of information where we may include or we may not include it. This is not going to have again a major impact on what we are trying to ask from the target reader. Again, I would clarify this. Look at the evaluation criteria, how they are designed. In your ability to consider necessary information, what is being tested is you should be able to select all key information and the information is accurately represented. Now, if you look at the descriptors here, yeah, the purpose criteria is scored out of 3, whereas rest of the evaluation criteria are scored out of 7. Now, what we are targeting here is 5. For B level, you should be getting 5 in each of the criteria. So here they have used this word, mostly addresses what is needed to continue care and it is accurately represented. So that is why I always give this kind of flexibility for 1 or 2 points in the case notes where it is not going to have a major impact on your overall score. Even in, if you look at 7th one, it says key information is included and no important detail is missing and it is accurately represented, right? So there will be 3 kinds of information: one which you must include, 2 which you must exclude, and there will be some piece of information, 1 or 2 points in each case notes where You may include it or you may not include it. It is not going to have a major impact on your overall score. So I would consider this infectious mononucleosis and a factory foreman, that kind of information where it's not going to have major impact, but sedentary lifestyle is must. Okay, now let us look at this treatment record here from 2018, April 2018 to November 2018. How much information do I need from this portion? What would be required for the endocrinologist?
On 26
Hmm.
06 2018, he just had feeling of rundown,
Hmm.
but that could be because of sore throat also.
Hmm.
And the rest of the things, I don't think it is much more relevant towards an endocrinologist.
Hmm. Okay, how about others? What do you all think? Feel free to share your perspective, discuss and debate. That's the only way to learn. How much information do I need from these 4 visits?
And we can also
Ma'am, we can include that on 17th that he is busy at work and feels tired and stressed.
Okay, so
Otherwise,
feeling
also,
run down is repetitive. If you see
yeah.
here also it is feeling run down.
Mm.
Here also you can see some tiredness and stress at work. So that's quite repetitive. I mean to say that that is going on for a long period of time.
we can also mention high BMI,
Yeah, overweight that he is
High
overweight.
BMI, yeah, that's going to be a risk factor. So that's important. But high BMI we also again have here as well. We have the latest BMI.
Hmm.
So probably we are going to include the latest one. So as a GP, I had all these visits, and if you want to prove that it is diabetes, you would also, go on to mention how frequently he got the infection. Like here, it was productive cough that is indicating infection. Here, sore throat is indicating infection. Diabetes, underlying diabetes can make them prone to get rotator cuff tear. So this all seem to be, in a way, some sort of very vague symptoms of diabetes that we had. Whereas feeling run down is a very prominent feature that comes across all the visits that we have had. So probably from this 4 visits, I'm going to highlight feeling run down, and the infections and rotator cuff tear I can mention as associated associated issues. So is any particular timeline important from these 4 visits? Is there anything that I should write in that particular timeline?
Oh man.
No. Yeah. None of the timelines are relevant here. Now, these 2 visits that we have, the most recent visits, 4-2 and 24-2. So these 2 seem to be the most relevant visits for the endocrinologist. So these 2 timeline can be considered as important timelines. So here, is there anything that we can exclude from these 2 visits?
If we are going to mention the recent BMI, then we can like exclude at least the BMI.
Yeah, the fourth BMI, we can exclude
Yeah.
that. Is there anything else that I can exclude? How
Busy
about,
at
Mhm. Go ahead.
reports busy at work. We can exclude that.
That's repetitive. Yeah, so we can generalize it. Okay. How about this point? Blood test ordered. Would I need that?
Yes, we have to include.
Not exactly if you're including the results in the
Yeah,
research.
we have the results, isn't it?
Yeah.
So even when I would be describing these two visits, probably I would not be writing it visit wise and saying that this things happened on this date, or this things happened on this date. Because again, this is not a very huge difference. You have just 20 days period on over which this is happening, and probably here you do not have any new symptoms coming in except deterioration in the vision. Rest of the symptoms are still the same. So it would be possible for me to generalize this visit, and in that way, I would not write such sentences where I would say I ordered the blood test and then I would go on to give the results. I can straight away write the results of the blood test and then the request for them. Right? So a lot of points you would see where you would not be able to completely exclude them, but you would have to learn how to summarize that information. And another important consideration that you would have to have is which timelines would you include. So if you see here, tiredness, yeah, that's going on for
The last 3-4
yeah,
days.
last few, you can say it is going on right from here 6 to this. So you can say it is a very long period for which they have been having this tiredness, and then gradually it has worsened to and they have started developing other symptoms as well. How about orthostatic hypotension? What am I going to do with that?
I mean, it should be included in diabetes, but then I don't see any supportive points to like say.
Dizziness, what do you think about dizziness? Wouldn't it be a supporting detail for orthostatic hypotension?
Yes, yes.
Yeah, isn't it? Hmm. So basically, this two visits are going to be the main, point that I'm going to highlight. And then here we have some details which we can't completely exclude. So here we will have to learn how would we generalize this four visits, as well as the social background, the hobbies, the medical history, and the occupation that he has. And then I also would have to highlight this. So again, coming back to the point that I made in the beginning, that I would need first of all symptoms or signs to prove that this is diabetes. So what all symptoms do I have in this case? I have the feeling of rundown, yeah, that is tiredness. Then I have sore eyes. Then I have dizziness,
Vision decrease.
deterioration in vision. So vision, poor vision, if I say. So these are straight away the subjective complaints that I have, subjective findings that I have. Then the objective findings that I have is low blood pressure. Okay, and then I have test results.
BMI.
Yeah, BMI test results to prove that this is diabetes. So this will be the most important thing that I have to mention. So when I'm trying to organize my information, again, this is what is important for me to highlight. See, what would happen is if I just go on to go visit wise, and if I convert all these points into sentences, what may happen is the target reader would not be able to get a clear picture in one go. So, for example, while I'm describing symptoms, and in between, if I go on to say that he's overweight and he's not willing to change his lifestyle and he reports busy at work, his weight is also so much and so much, it would be, yeah, it is important as a risk factor. But the thought process that you have usually when you are diagnosing something is you look at the subjective findings, you look at the objective findings, you look at the test results, and then you think about what may be the contributing factors that could be leading to this condition. So whenever you are looking for writing a good summary, you can have this way of writing a summary. First, you can summarize all the details about the symptoms, characteristic. If it is pain, for example, what kind of pain it is, what are the associated symptoms, the timeline. Then After symptoms, you can support the symptoms with objective findings and the blood test reports. And then finally, you can write one entire paragraph explaining them that what do you think could be the contributing factors to this condition, or what might have led to the development of this condition. So in this case, what would happen is the BMI, they would all be considered as contributing factor or risk factors. So that gives them a clear idea as to, you know, what may be causing this problem. And that would also be very helpful to you to provide a clear summary, because see, the risk factors are not timeline wise, right? It is not that on 4/2 he was having this much of weight and then there is a significant change in his weight now. So while writing about the risk factors, you may not need timeline as such. So always it is a good idea while writing referral letter. The case notes will give you all the things in one date. You may not need to write everything date wise. What you have to do is you would have to think of the symptoms separately, the physical examination findings separately. In the physical examination findings also always try to include the most recent ones. So in the both visits, the blood pressure is low, but I don't need to go give that visit wise. I can simply write about today's blood pressure, today's heart rate, and today's BMI. So that would help me to, automatically exclude details which are not now relevant for the target reader. So after we have discussed this much, now let us think about paragraphing. How would I go about paragraphing? We have three ways in which you can decide your paragraphing. Yeah. For any of the letter that you are writing in OET, there can be three possible strategies that you can follow to decide which style of paragraphing would you have. First is when you have the when you are writing a letter for a specific issue, so you write the main issue first and then the associated issues. Then second type of letter you can have is chronology. So chronology is, for example, if you are describing a patient with Parkinson's disease, or if you are describing a patient who has developed radiculopathy related to some spinal injury, and then you want to show how the pain has deteriorated. So you go chronology wise. You write what was their situation 6 months ago and what is their situation now. And third way of writing is you go problem solution wise. So for example, if you're writing a letter for more than one issue, then you write that issue in that paragraph and you write what should be done about it. This is more appropriate when you are writing discharge summaries, because when you are discharging the patient, definitely you would have more than one thing to look after. Whereas referral letters can be either written main issue wise or chronology wise. So here in this letter, which one do you think would be more appropriate? Which style would I go with?
I think we can
Issue
go with the
analysis.
main list.
1, 2, or 3?
I would go with one.
1.
We can say that um, he has been diagnosed with diabetes, and then we can jot down the different points suggesting of why we thought so and what are
Yeah.
his recent lab results and everything.
Yeah, exactly. Because you have one issue here, the main issue diabetes, and then you have some associated problems which are not, directly irrelevant. They are relevant, but again, you don't need visit-wise those things. So going chronology-wise would not be appropriate here, because basically I don't need any of these things visit-wise. I just need this two things visit-wise. That's all. Yeah. Do you both agree with this, Faiz and Kathan?
Yes, ma'am.
First one?
Yes, ma'am.
Yeah. Okay. So what we would do basically here is this entire portion would go in second and third paragraph. And here when I would write about the tiredness, I would clarify the timeline. I would clarify for how long they have tiredness, and then other associated features can all go as risk factors and associated features in fourth and fifth paragraphs. So here also I can divide. Risk factors can be written in one paragraph, and other associated factors like medical history kind of things can go in the fifth paragraph, or vice versa. It really doesn't matter much because we have already prioritized this. Now again, let me explain you why it is important for us to plan this with the help of evaluation criteria. So see here, the evaluation criteria, we looked at conciseness, clarity. Now look at organization and layout. So what is it saying? The organization and layout criteria. It says health professional value documents that are clearly structured. So it is easy for them to efficiently retrieve relevant information. So you have to put yourself in their shoes. If you were this endocrinologist, how would you prefer this information to be organized? Right? So that is one criteria you have to keep in mind. It should be clearly structured, so it becomes easier for them to retrieve information. Then, so one point of it is whether paragraphing is appropriate. And you can decide which style of paragraphing are you going. Like as we just discussed, if you are going chronology wise, that means one particular paragraph would describe one timeline. If you are going main issue wise, then one paragraph will highlight main issues and other paragraph would talk about associated issues. So subsections within the document are logically organized or not. Here also, they look at your ability to organize not just paragraphs, but within paragraph also whether your sentences are flowing, okay, or not. And then the second half is layout, writing date appropriately, writing address appropriately, and those factors are to be taken into consideration. Now, what is genre and style, right? So genre and style again looks at audience awareness. So if you're writing to a specialist, it is okay to use certain abbreviations, like when you write HbA1c, FBS, okay? So when you are writing to endocrinologist, it is appropriate to use them. But when you are writing as a specialist, if you are writing to a GP, then you should not use so many of abbreviations which you think the GP would not be very much familiar with, or it may not be his day-to-day thing that he would come across. So keeping that in mind, you would have to make judicial use of abbreviations. And style looks at your ability to give appropriate register and tone. So using polite expressions, being non-judgmental, those are the things which are assessed in genre and style. So what I'm going to do next is I'll discuss the model answer with you and I'll give reasoning why I have written certain things in that way. Okay, and then we are going to discuss whether it makes retrieval of information easier for the target reader or not. Okay. So here in the case notes, it mentions that it is preliminary diagnosis. It is not yet confirmed. So a brief introduction of who they are and signs and symptoms consistent with, because we are not yet sure about the confirmed diagnosis. And diabetes, you have diabetes, the word itself doesn't require capitalization, but type 1 or type 2 if you are using, then the T would be capital. So two things you must have clearly mentioned in the introduction paragraph according to the purpose criteria. Purpose criteria assesses two things. One is whether you are able to mention the purpose initially in the introduction paragraph or not. So if you don't write in the introduction paragraph the purpose, then you are going to lose mark in the purpose criteria. So it's very, very important. And just writing, I'm writing to refer is not the purpose. Refer for what, that has to be clearly mentioned. And the disease condition, the main reason for which you are referring them. So what is the diagnosis and what is the purpose? So introduction paragraph has to be this brief, just to give them an overall idea as to why this letter is being written and what do we expect them to do. So you will have to modify your language here based on what kind of letter you are dealing with. Then here in the second paragraph, we are trying to give them a brief overview of how the symptoms have presented over a period of time. So the tiredness was going on for a long time. So for the past 5 months has been experiencing. So it was going on for a long period of time. So present perfect tense we have used here. Unusual tiredness, which was initially attributed to his increased weight and stress. Because that at that point of time we suggested him to do exercises. So I haven't included those things in detail that I suggested to do exercises and those things, but initially why we did not act upon is because we thought it could be because of his weight and the stressful lifestyle. Then using appropriate linker to tell them that now we are talking about his recent condition. So here I have not used a specific date. You can also use that, is also fine if you include that, however, on so and so date he presented to my clinic with complaints of. That structure can also go very well. Okay? Here it is just that I have tried a different style. So more recently he has developed impaired vision and pain in the eyes. He also reported episodes of dizziness. And on the most recent examination, so here you can write examination today if you are writing date wise, then you can write about their blood pressure. So here again, if you will see, I have not included BMI and overweight things because I'm going to take them as contributing factors for diabetes. Then here the blood test results, instead of saying that I ordered blood test, because the main reason is because I'm not going date wise. If you go date wise, then probably you can write from here on the most recent examination. Instead of that, you can write the date here today. So here in this portion, you can write about this sentence for the past 5 months. And then here, however, here instead of writing more recently, you can directly write for, whatever the date it is, the second last visit. And then from this visit, you can write about today's visit, this paragraph. That is also a possible way of writing. Then here we wrote all the blood test results that we have. And here itself, we have made a request. Therefore, he requires your specialist advice for the confirmation of type 2 diabetes or the provisional diagnosis. And then the background medical issues. So this is the summary of all previous visits that he had. He has had frequent infections along with a rotator cuff tear injury to the left shoulder over the past year. So has had is present perfect tense because it was going on for infections he had frequently. So that is the reason. And here I have specified all rotator cuff tear injury. So it is clear that it happened once only. And he contracted infectious mononucleosis in 2006. This again, as I told you, can be excluded as well. And then here, what are the contributing factors? So just in one sentence, you can summarize all the contributing factors. A high BMI, sedentary lifestyle, and stressful work situation. And his inability to follow lifestyle modification, so that endocrinologist gets the message that probably they would need to start them on medication, not just the lifestyle modification probably would not work for them. Okay, so here we used a complex sentence that he's attending physiotherapy, but otherwise he's not able to make lifestyle modification. And then here a final request, your assistance in developing a suitable treatment plan would be highly appreciated. So while you are deciding paragraphing, you will have to keep two things in mind: grouping of information and priority. Okay? So we prioritized information here. You can change grouping of information. As I mentioned earlier, you can make slight difference to this organization. But first two paragraphs, after introduction paragraph, first two paragraphs must be about the latest visits. And then later on, you can write about the risk factors and the other associated issues that they have. And then a final request. So any questions so far from this model answer, and anything that you felt would be changing the meaning of what we are trying to convey, or anything if you think which would be, could have been written in much better way. Any doubt about the tenses that have been used here? For example, if you see the blood test results, I've used past tense because when I saw the result, that point is over. So here, if you say HbA1c is 8.5, that is also perfectly fine. It is not going to change the meaning.
Ma'am, can
Hmm.
you write high BMI and sedentary lifestyle and stressful work along the either first or a second paragraph? Can we do?
So in that case, what we would do is, here, after writing the 5 months factor, instead of writing more recently, you could have written the second last visit. However, on 4 so and so, he presented to my clinic with this complaints, in that way. And then in third paragraph, when you would write about today's visit, you can write all the findings of physical examination. In that itself, you can include the BMI and sedentary lifestyle and stressful work. So in that case, one paragraph would be reduced. You would just then need 4 paragraphs. So that is also possible.
Ma'am, using the perfect date for the last 2 visits, so it would be a good impression, no, for accuracy of the text. So,
Accuracy of the text, yeah.
yes, so if we could have used the dates for the last 2 visits,
Instead of writing more recently.
yes,
Yeah.
so it would be more accurate.
More accurate. The only reason is, here when we talk about frequent episodes of dizziness, like if you look at the case notes here, the timelines in the case notes also are not very clearly mentioned. So here it says dizzy sometimes for last 3 to 4 weeks. So he visited me on 4/2, but dizziness is not starting from 4/2. So the case note itself is not giving me a clear timeline. The tiredness is going on for a very long time. And this sore eyes and decreased vision is present in both the visits. So that is the reason I chose writing more recently.
And the ma'am, tests were conducted on 4th in the notes.
Yeah, tests were conducted on 4th, but the results we have got are today. So in 4th, it just tells us that, we ordered some tests.
Yeah.
But we have got reports today.
Ma'am,
And again, when we talk about HbA1c and those things, it is not going to make a huge difference if I mention timeline or not, because HbA1c we look for last 3 or 4 months
4 months.
sugar levels. So in that case, probably saying exactly on which date I ordered the blood test is not going to make a huge difference.
I don't think it would make a huge difference if we mention the dates. We can just write more recently or today's, whatever the date we are writing on the letter.
The results, no?
Yeah.
Yeah. So here, what would happen is, if you want to write date wise in second paragraph after reporting tiredness, you can write that today he also reported to have dizziness. But again, you would have to clarify that today he reported that he he has had some episodes of dizziness over the last 1 month. So again, it is not starting, dizziness is not starting exactly on 4/2. He told us on 4/2, but it was going on for last 1 month prior to that visit. So here, if I go visit wise, then what would happen is I would have to write here on 4th. He presented to my clinic with sore eyes and those things. Then again, today's visit, I would have to clarify that, the symptoms have persisted till today, and these are the test results.
Then about deranged lipid profile, we could have been more specific now.
See, while writing to endocrinologist and when I'm sending the referral letter, it doesn't mean that they would not receive the test results. Why I'm writing referral letter is to give them a summary of what is being asked from them. So that is the reason why we did not specify the exact value of the lipid profile. We wrote the exact value of things which they are directly involved in. So they would be directly involved in HbA1c, RBS, and FBS. But lipid profile is slightly parallel issue to the diabetes.
Ma'am, we could have used hyperlipidemia word.
Yeah, hyperlipidemia would be fine. Yes, because here also it mentions that LDL is high, so you could also use that word. You can say increased level of lipids, hyperlipidemia, both the way it is correct. Anything else from this? So now what all of you have to do is you have to write this letter on your own, and you would have to submit it to me for correction. You would have to type it in the Word file, and you would have to name your Word file with your name and the task number. This is classwork writing task 6. So for example, if you are writing, it will be your name, Priya. Then you would be writing the number of tests that you are doing, classwork test 6. And if you are a medicine student, then please write DR, so it helps me to distinguish from the nursing candidates. And you will have to send your task through email on this email ID. And you can try all the other different ways that we discussed. Okay, so when you would have written in that way, it would give you an idea as to how those tasks, and then you can compare it. Which one is helpful in retrieving the main idea from the task.
Ma'am, can we just write on paper and scan it and then send you?
The problem with that is if you write on the paper, it is going to be difficult for me to provide you detailed feedback. If it is typed one, I would be able to give you a clear feedback. Even in the sentences, if you have not been able to write proper sentence, if there are errors in commas, articles, so all those things I can't really point out in the image. If it is typed one, it becomes easier for me to comment on that, because Word files, Word gives me a lot of opportunity to make changes. So it gives you a clear idea as to exactly where the problem is.